Hey Tracy, how are you?
I'm good. How are you?
Good. Having a beautiful morning here in Maine. Just did a little run and out of the shower and thought I'd touch base with you for a little bit. I was looking at week 3 and some of our students' PICO questions here. And for me, it's always, I kind of have some reservation about whether the PICO question should be something that's related to all healthcare or just, kind of nursing interventions, or what do you think? Have you seen that?
I have. Yeah, and looking over the PICO questions, I do notice that there are a few that aren't necessarily nursing driven. And what that means is that from a nursing standpoint, we really wouldn't have control. So like, for example, there's one research question that has to do with CBD and epilepsy. Well, CBD currently isn't FDA regulated, and it's not being able to be prescribed unless in a pediatric. So if you're going to use that, that would be pediatric. But CBD is a drug that would be prescribed by a physician. So nursing wouldn't have a lot of input into that practice. Another would be choice
Right.
of C-section, right? Choice of C-section uh, instead of going full term. That's really a physician decision with their patient happening externally that a nurse would not have control over.
Well, what about, I was also thinking a lot of these students are going to be nurse practitioners. So when we want it to be something that would be maybe in the scope of a nurse practitioner, and that maybe C-section would be in the scope of a nurse practitioner.
So that would still be in a collaboration with a physician because nurse practitioners aren't delivering the babies.
So we just
They're
want to
not
say
doing
something that's either
C-sections.
nursing or nurse practitioner driven. So something that we have a locus of control over, and that is in the scope of nursing or nurse practitioner practice.
Right. So nurse practitioners obviously are caring for the moms and the babies, but they're not necessarily doing the C-sections. So that's a
Right.
physician, midwives would have a more of a collaboration with physician if they're going to do a C-section. But the C-section is not under the locus of control of a nurse. So really, the PICO question the center needs to be nursing driven. Some type of intervention that we have
Right.
some type of control over. Another example is any kind of pharmaceutical. And I think I talked about this with a couple
Right.
people on week 2 is pharmaceuticals is a whole different type of research. They have their clinical trials. Once it's been established that it works, it's difficult to take away. You can add something or you can minimize the use depending on the
Right.
drug. But really you want to focus on what we have control over in the nursing component.
Hey, what if we share some of those resources with the students that we have on our Canvas site, just to
Okay.
show what might be some nursing ones? So let me
All right.
just share my screen here. And so in our week 3 readings, there's a hyperlink right here that says resources for finding EBP ideas. And if you click on that, it brings you up to some information about what's been at like the Western Institute of Nursing conferences. So that might give them some ideas about, what nurses have been looking into. Here's something from the American Academy of Nurses, and they say 25 things nurses and patients should question. So these might be some good examples, don't you think? Things
Yeah,
that,
I agree. These are great examples.
so here's, don't let older adults lie in bed or only get up to a chair during their hospital stay. So really a PICO from this would be in hospitalized older adult patients. What is the effect of ambulation or frequent ambulation compared to lying in bed only on maybe
Length of
length of
stay.
stay? Yeah. Yeah. And then, so that's a great resource I think we can give the students. And then the other one in here on this, this PDF from Judy Davidson in here, she had a lot of good examples of, she goes through, you know, what is EBP in research, and goes through some of the differences here. But a lot of her examples, and sorry for scrolling through here, giving everybody a headache, but a lot of her examples are nurse related. So this one, she asked, what about fetal positioning? So that's something that's directly nursing related.
Right, and with this one, I've used this presentation in the past. The key word here for an evidence-based practice project versus a research is there is evidence in the literature about the benefits. So you're building on evidence that already exists. I know there's multiple examples of where you have to decide in this PowerPoint where it's PI, evidence-based practice, or research. So obviously here, there is evidence in the literature. This would be an evidence-based practice project.
So this is, why wouldn't it be a PI project?
So the reason that, well, this is how I try and identify is process, they get muddy, believe me, they do, is most quality improvement in practice that I've seen is usually rate driven. So it's usually numbers, we're looking at decreasing or increasing. So the focus in clinical practice is really a reduction or increase in a rate, or changing a process to decrease or increase a rate. So if you look at CODI or CLABSI, right? Those are all QI, yeah.
Right. And I think with this one too, keywords is evidence in the literature. So we know it's not research. It could be performance improvement. It could be EBP, but here it says she found that it is being used across the town, but not in her unit. So it's already, so maybe this one would be PI. Let's go back up to those where it says what the differences are. There we go. So PI is when you are going to do process improvement. So it's already being used at your facility, but you want to improve it. So, and EBP says that it's a new protocol. So yeah, this one would be a EBP. Yeah. Thanks for showing me that.
They get super muddy. Like some of our quality improvement projects, you're like, that could be EBP or QI. For the purpose of this class, we're not doing QI, we're doing evidence-based, so we'll focus on those.
So this one might be tricky too. Julie wants to bring meditation for stress and pain. She wants to create a short version and test the use of a patient-reported quality of life. Is it a survey? To see if it reduces compassion fatigue. She has not found an article about meditation CF in the literature. Ding, ding, ding.
Yeah, and then the other thing here in the bullet point above is she wants to create. So she's creating something, that word right there, and she doesn't have any literature to support it. You're building knowledge, so new knowledge.
Research.
Yeah.
Okay. And Melissa, the CODI rates in this organization are high. Melissa hears that other hospitals use nurse-driven protocols for urinary catheter removals. She finds evidence in the literature this works. The CDC guidelines endorse this practice. This is PI, EBP, or research.
So this one gets muddy too. It could be, in my practice, this would be considered a quality improvement. They are taking a protocol to improve the process, but their main goal is to decrease CODI rates. So they're going to use that PDCA cycle. So they're going to look at their numbers, they're going to implement the practice, they're going to check it and do their analysis of information. And if the numbers decreased, then they would either continue the protocol or they would need to figure out another intervention to implement.
Right.
Evidence-based practice part of it would be the actual protocol.
Right. So they're bringing a protocol
Exactly.
in. So bringing the protocol to the hospital would be the EBP part.
Right. The quality improvement part is the PDCA cycle, looking at CAUTI rates and wanting to decrease that. So, like I said, it gets a little much.
But we know it's not research anyways, because she finds evidence in the literature. All righty. Sarah, surgical site infections during C-sections are problematic. Sarah's been observing her peers and sees that they are not following the standards. Some have artificial nails, some don't scrub for the appropriate time, and some don't prep the abdomen properly. So like we were talking about with C-section, this is more nurse-driven, where you are getting the person ready to decrease infections. So her project will educate to improve adherence to existing standards for surgical prep and surgical site infection. So what do you think this would be?
So because the main goal is to reduce site infections, I think this is quality improvement. Well, take that aside, I think this is an accountability issue because the nurses aren't following the standards.
Right. So this was something they already had, a standard they already had at their site, but they're trying to improve the standard that's already there. So that would be PI.
Yep.
All right. I think this is pretty helpful, and it really shows some great examples of nurse-driven interventions.
Right.
All right. Well, hopefully we can look at the learning activity for this week due on Sunday, is where the students will all be posting a EBP question that they want to use for their big EBP assignment. So maybe we can take a look at those and see if we can kind of make sure that those are EBP questions instead of research or quality improvement.
Okay.
All right. Well, have a great day. Good to see you. Good to talk with you. Looks like you're at work.
I am.
Oh, all right.
All right.